How would you explain or describe physio to a friend? Let's say one of your friends has been injured. What would you tell them?
It's really good. I'd recommend it, definitely. It's helped me loads.
What about the actual process, like inside the like treatment room? Could you describe to them what goes on?
Yeah, I mean, to be honest, it's completely different to what I was expecting. But it's like I said, it's really helped loads. And he sort of, with Lewis that I'm seeing at the minute, he sort of finds exactly the trouble areas, and he knows what to do to help it.
Does it hurt?
It did at first, like the first couple of sessions it hurt, but now it doesn't, it helps more than hurt.
So how long did you have your pain before you first came in for physio?
It was a good few months.
Why did you wait?
I waited just because I just did. I
didn't know what to do?
No.
And what was the final push then towards private physio?
Well, I spoke to my mum and she suggested it because my mum's had a bit of a fall at work and she went for physio.
I think you have to have confidence in the person and all.
Well, the person has to be confident as well, who you're seeing, you know. You know, if you ask a question, he's got to be able to, or they've got to be able to answer the question. Which I think the physios here do, on the whole.
How would you describe physio to somebody who's watching this video now and has never had physio before? What would you say? What would you tell them about the experience?
I would just say, don't be frightened, go for it. What happens to you, the quality of life you have after it, far outweighs the bit of pain you're going to get.
Yeah, but it's not just a one-off thing, that's what you've got to remember. You just don't go for one treatment. It doesn't work that way. It's maybe a 3, 4, 5, 6 treatments before you start to see benefits of it. And you've got to learn to do as you're told as well. Not just get the treatment and walk away. There might be exercises to do, there might be, you know, bits and pieces you've got to do. You've got to do the lot. You can't just walk away from it and say, oh, that's it, I'm happy with that.
I think now back again to patients when they come in, can you instinctively pick up on somebody when they ring or when they come into reception if they've ever had physio before?
Sometimes the wording that people use, we can tell if somebody knows specifically.
I think if they're asking
areas,
what to wear and asking what's happening and, you know, does it hurt and things, then they're nervous, they're new to it, they've never really experienced these things.
And what about the changing them as the weeks go on?
Oh, they become
relaxed,
yeah,
isn't it?
so chilled and so friendly. Like how we get on with patients is
more like friends, isn't it?
Yeah.
I mean, we've got a lot of patients now that are more like friends to us than what we would say that they were patients. That, yeah, they're coming in, we can just talk to them as if we would ring one of our friends up on the phone or anything like that.
It was off. It was sore. After maybe 4 or 5 days, I just thought I need to see some kind of progression to get better, because like I have 2 children and I'm active and I just couldn't sit around the house. I needed to see someone to get better. And then if you can ask Lewis, my physio, I had literally no hope when I came here. And then after maybe 1 or 2 sessions, now I skip in, because when I come out I feel a lot better, like I've achieved closer to my goal for my leg to get better. The best thing about it is that, well, it's all is really, because I wouldn't have known what to do with my leg. I didn't even understand my full, what do you call it, the extent of my injuries,
yep,
until the physios actually explained everything to me, and I didn't even realise how bad it was until I got here. Because if I'd have thought it was that bad, I wouldn't have had no hope whatsoever.
I couldn't see Paul over the last few months after being recommended by my family. I had a problem with my neck over the last couple of years. I'd been for MRIs, X-rays, and apparently it was just an old injury. It would take a couple of years to heal. What I think I've found since then is Paul has been able to probably give a lot of credibility to physiotherapists everywhere, but especially for himself, because whatever he's done, he's freed it off, and he's given me a treatment which is sustainable, and I'm doing all of the things that I was 2 years ago without any pain.
Compared to, let's say, dentists where you've worked in the past, is it different?
well, we get a lot of thank yous. We get gifts from people, which you know that you've obviously made a lovely connection with them, for someone to be so kind to do that. That was something I'd never come across before where I've worked.
I think it's just like more of a relaxed atmosphere. I mean, you think physio and you automatically think it's a clinical place, and you think that everything's just going to be strict and like not friendly or welcoming, whereas working here I feel like it's a more relaxed atmosphere, and I think that rubs off on the patients, so they feel more relaxed when they're going in for their treatment than what they would going to an actual clinic.
Like seeing a doctor,
Yeah.
you go to the doctor's reception. Sorry, your mum works in one.
But she's always in here. She spends more time in here than she does in the doctor's surgery.
The reception is there's a barrier, and you can't speak with them, you can't...
Once you've checked in, you go and set your seat out the way.
That's you gone, whereas here you don't get that.
What you get here?
Maybe
Coffee, TV. Yeah.
I think when I thought of physio in the past, my perception of it was that you only ever had it when you had an accident or you've been in a car accident or anything like that, but it's actually not. It's getting your body to fitness to do your sport or whatever you do, and make sure that you're not going to pick any other injuries up going forward.
If you had to describe it to a friend, or let's say your mum hurt her back and she was and ahhing to go for physio, what would you say to her about the whole kind of experience of physio?
Just go and get it done. Every from the whole experience, from walking in the door to leaving the door, you'll find that it's really friendly, that the physios explain everything to you, so you know exactly what treatment you get, and you've got a kind of an idea of how long it may take to get better and what your other options are as well. So the longer you leave it, the longer you're just in mid-air really, and you're not going to get anywhere to get better.
On quite a few occasions I've needed to come for physio treatment. I play squash regularly and generally try to keep fit, but nobody's getting any younger, and invariably I'm suffering from the odd injury, but my calf, my back, my shoulder, varying muscular problems, crick necks, things like this. I don't trouble the doctor with them really. I know I can come to a decent physio, have the treatment, few sessions, normally puts me right. You've got to do the rest part as well, but the physio certainly helps, gets you on the right track of getting it repaired as quick as possible, and it's always the way forward for me, and it's always done good for me.
What's the best thing about physio?
The massage is quite nice.
Not the pain that I caused you.
No, the pain's fine. And obviously, it for me personally, it reduces a lot of stiffness. So I feel like I have a lot more mobility after I've had the physio treatment.
What about coming here? What do you enjoy about coming here the best?
It's relaxed, I guess, relaxed atmosphere, and recommendation, I suppose.
If you had a friend who had a bad back or a shoulder or neck, would you recommend physio?
Of course.
How would you describe it?
Yeah, of course, yeah.
How would you describe physio? To your best friend. Imagine your best friend's got a bad back. How would you describe it to her?
How would I describe physio? I suppose manipulation to free up the joints. With that little, I don't know what that is that you do.
Crack.
Coming in is very welcoming. They're all happy to help you out, and also the physiotherapist, lovely, and if you've got any questions to ask, she's happy to help you out, and the treatment is fantastic.
Stop lying. Does she hate you?
She does.
And what were you like on the day? What, were you apprehensive, or what was going through your head?
I actually thought I was going for a nice massage. I thought they'd have made a bit of music.
The jacuzzi and all that afterwards. Yeah. You got me.
Paul. That's what I thought. And obviously when I was in there, it's not a therapeutic, chilled out massage.
Jeanette?
Well, I came because of my whiplash that I had to my neck, but because I was doing a lot of swimming as well at the time, so it was never relaxed. I always had that tension there. But for me, I absolutely looked forward to it, and no matter how painful it was, I just loved having that treatment because it was such a relief when you're doing sports. No matter how, you get such a build-up of tension, and it didn't matter how painful it was after that, it was such a relief.